Hello, my name is Dr. Meg Whitley and I'm a registrar with the Central Coast Local Health District Public Health Unit, and today I'd like to talk to you about the Pets are Family Too project. Firstly, I'd like to acknowledge that I'm coming to you from Darkinjung country and pay my respect to elders past, present and emerging, and extend that respect to any Aboriginal people who are watching today. 69% of Australian households own pets, with approximately 8.1 million pet owners hospitalised yearly. Pets are really important to people, providing unconditional love, loyalty, non-judgmental company and connections that people may not otherwise feel, particularly those who tend to withdraw from others. Many people therefore consider their pets to be a valued family member. Pets can reduce stress, loneliness, anxiety and low morale that accompany ill health. So when people are admitted to hospital, this valued contact abruptly ceases. Separation from a pet during a personal crisis can lead to severe depressive symptoms. Carers and pets themselves can also be adversely impacted by the separation. For example, pets experiencing separation anxiety and depression, and carers inheriting responsibility for pet care and shared distress. Some pet owners delay or prevent seeking medical attention, knowing their pets are going to be left without them. Research into animal interventions in healthcare has largely focused on therapy animals rather than personal pet visits, but we know there is a difference between interacting with one's own pet rather than an unknown animal. So we've identified this issue, but what can we do about it? The Pets are Family Too pilot study commenced in 2018 with collaboration between the Public Health Unit, Carer Support Unit, volunteers, local health district and external partners, including the RSPCA, and culminated in 13 facilitated pet visits to the cancer and renal ward at Gosford Hospital. An important component of these visits was partnering with carers and the Carer Support Unit. This physical space could be used to practically settle pets and host some visits, but was a key enabler to these visits occurring. A risk assessment tool was developed to help facilitate wards decision-making on the safety of having pets in the hospital setting in accordance with New South Wales guidance. So what did we find? Data was collected from patients, carers, and the project officer facilitating the research, including opportunities to share stories, expectations, evaluations, areas for improvement and reflections. Preliminary findings showed the project was a huge success. There was improvement in mood, motivation, well-being, happiness and joy, opportunity for goodbyes, transfer of responsibility. Carers felt they were doing something really meaningful and special for their loved ones. We also saw greater engagement of carers with the Carer Support Unit, including some carers only becoming aware of the support open to them through the project. Staff morale and well-being was improved, with new ways that staff could connect with their patients and provide care. No adverse events were seen. The project received the Caring for the Coast Award for Excellence in Patient Safety and Experience of 2021. So congratulations to the team that was working on the project. It wouldn't be a pet project without some beautiful and heartwarming pictures. So we've had this success. Where do we go from here? Improving patient well-being and engaging with carers are two New South Wales health priorities. For the next phase of this project, we hope to provide transformative care to patients and carers in hospital settings by enabling personal pet visits. We recognise that we've got New South Wales health guidelines to enable pet visits, but they're not embedded into routine practice. So we hope to test an implementation strategy to support the broader uptake of the New South Wales health guidelines and align them with the Pets are Family Too initiative. We hope to look at the scalability and feasibility across New South Wales and explore barriers and enablers of pet visits, as well as attitudes, awareness, knowledge, impacts on patients, carers and staff. We are going to roll out the project across Gosford, Wyong and Woy Woy hospitals, as well as scoping for a pilot project in Lismore. Again, engagement with carers is a key feature of the project. We recognise that in different settings, there are different facilities and physical spaces, so we hope to explore this. As part of the research, we've partnered with appropriate and multiple partners to ensure best practice and representation of all voices. We're really excited to embed pet visits into routine practice and improve the overall well-being of patients, carers and staff. Thank you very much for listening.